Medicare is not healthcare. In common language, we're often going to be using medical care to describe a bit of everything. We might use it to describe what a GP is doing, what a surgeon's doing, what a physiotherapist is doing, what a chiropractor is doing, what a nutritionist is doing, what you're doing with your exercise, your sleep, your yoga, all of these different things. However, medical care is not an all-encompassing term. You see, medical care is what you would prescribe when your body system has been so far corrupted, so far injured, that really there's no other alternative except to treat the symptom. And how do you do that? You offer relief through medications, through prescriptions, sometimes even surgery, depending on what the nature of it is. But here's the thing about that, is before you get to that level, that degree of damage, you've got all of this broad zone here where, you know what, it may not be 100% perfect, but it's not all the way down here either. And now here's the thing, is if you try taking then the medical approach strategy and try to apply it to keep you healthy, it doesn't actually work. You see, if you've got a physical injury, a physical ailment in your body, something's not quite moving right, something's just jammed up a little bit, there's tight muscles and things like that, you can take all of the medications, all of the supplements in the world, but if you have a physical problem, treating it chemically is not going to solve it. If you have an emotional problem, treating it physically is not going to solve it. And if it's a chemical problem, treating it emotionally is not going to solve it either. So what we have to understand is that we can have things affect our health and our well-being on these multiple different areas, the physical, the chemical, and the mental. But there's also a broad spectrum, all the way from the keeping us healthy all the way up here, and through different strategies, oftentimes the natural strategies which are congruent with the way that the body works. We do these things which falls in the realm of healthcare so that we do not have to fall into the realm of medical care. And when we try to use a healthcare approach in a medical situation, it may not work either. Why? Because if the system is so far gone, it's going to take something just to prop it up. And until we have a cure for time, gravity, and the continual stresses of daily living, certain injuries, certain damages, just simply put, can't be undone. But what we need is greater clarity and more appropriate use of our words, an understanding that healthcare and medical care are not the same thing. That a medical-based strategy is going to be different than a healthcare-based strategy. And these are not necessarily at odds with each other. It's that there is a certain time and place, depending on the nature of the situation, where each one is appropriate. Here's my challenge for you this week then, is have a look at your overall life situation, recognizing that you've probably got a variety of different things, some of which may fall into the medical care arena, but others still that fall in the healthcare arena. What is the nature of what you actually have going on, and are you following the appropriate kinds of strategies that are actually going to help you get the resolution that you are seeking? Because if you've got a medically based strategy, you're probably going to need to go with a medical solution. But if you're talking about something in the healthcare arena, keeping things working as high as possible at the greatest level so that they don't fall all the way down into the medical system, then what you're ultimately going to need to look at is going to be a health-based solution. And guess what? The vast majority of the time, that's going to be something that you are able to do on your own, or at the very least, with very little guidance that simply is allowing your body to work the way it's supposed to from inside out. Hope you've enjoyed watching this video. We'll see you next time. This is Dr.
For more information about upper cervical care, please call us on 3188 9329 or visit us at atlashealth.com.au.